Hello and good morning. Welcome to our Ontario network of CAPC and CPNP projects special event. Really excited to have you here today, and just really excited about this event, acknowledging and bringing awareness to Maternal Mental Health Awareness Day. That's coming up next week. We have a couple of really awesome presenters and I think some really great opportunity to connect today and to learn together. I would like to begin us from a place of acknowledgement and gratitude, and offer that our Ontario network of CAPC and CPNP projects acknowledges and gives thanks to the First Peoples and other Indigenous people of the territories where we work and serve. Gratitude for sharing this land that allows us to continue our work with families all across Ontario. And in Ontario, there are, I understand, 13 distinct groups of First Nations peoples, each with their own language, customs, and territories. And these nations are the Algonquin, Mississauga, Ojibwe, Cree, Odawa, Potawatomi, Delaware, the Haudenosaunee, which are the Mohawk, Onondaga, Onyotaka, Cayuga, Tuscarora, and Seneca peoples. So with that, I'd like to do just a little bit of housekeeping. And first, I want to point out that there should be subtitles or closed captioning available. And you know what? I don't think I have that set up. So my apologies. I'll see if I can get it set up as we go. If we do, I will post it in the chat and let you know how to turn it on. And the other thing I wanted to let you know is that we do have a giveaway today. And let me just share my screen here for a little bit to show you what we have got. Oh dear, no, I've got things all bungled up. Let me try that again. We have got a copy of a book. Are you seeing that there? This is an anthology that has been put together, and I'm sure our presenters may speak to this a little bit when we hear from them. So we have 3 copies of this anthology called You Are Not Alone that we will be giving away at the end of today's session. So there'll be some quiz questions coming up in the chat. So make sure to keep your eyes open. And finally, what I wanted to let you know about was a resource page here that our network has put together to support our projects in recognizing maternal mental health and acknowledging World Maternal Mental Health Day, which is coming up next week. And I just want to give you a quick peek at it. It's a Trello page. Are you seeing it there? Blanca, do you see it?
Yep, it's there, Sydney.
Okay, great. So on this page are some social media posts that can be used and shared on Facebook or whatever social media platforms you're on, as well as some resources, which include some resources that are available from the Canadian Mental, I'm just really spacey today, the Canadian Perinatal Mental Health Collaborative, including, I believe, a Facebook group that is hosted as well. So I will put the link to this page in the chat, and you're welcome to check it out, access some of the resources. These Trello pages are fairly simple to navigate. You just simply scroll through the columns and also open up each of the cards to access the information. So again, there are 3 kind of Facebook posts here that can be used. And there are 5 tip posts that are in a kind of a Instagram story format that are available. And these tips were gathered from the Mother's Mental Health Toolkit, which is a resource that we love and like to promote here in the network. So again, I will put the link to this page in the chat, and I hope you find it a useful resource. And Blanca, do we want to, here, let me show the poll, and we can see who we've got here. Are you seeing the results?
Yep.
So it's looking like a small percentage of most people's program manager or coordinator. And we've also got 49% direct service delivery, some home visiting folks, and peer educator support people joining us.
Great.
So we're really glad to have you here. Welcome. And I think this is where it's like enough of Sydney already. I think that's all the things I wanted to say. And let me pass it over to Blanca to introduce our guests.
Okay. Thank you, Sydney. Well, good morning, everybody, and welcome. Thank you for joining us this morning for our network's maternal mental health event that we're always so excited to host. The last couple of years, Sydney and I have been hosting. Prior to that, I work with the Public Health Agency of Canada with CPMHC, and our Ontario regional office has held an event every year before the pandemic, in person, of course. But one of the silver linings, I think, of our reality now is that we're able to do it with many more people, and we're able to have guests from across, wherever they are. Like today, we're having Jaime and Patricia, which I think if we were doing it in person, probably wouldn't happen. So that's it's great that we're able to do that now, and we've done it for this celebration in this format the last couple of years. And as Sydney mentioned, World Maternal Mental Health Awareness Day is May 4th this year, so next Wednesday. This year's theme is Stronger Together. So we really encourage everyone. Next week, we wanted to host this event actually early in anticipation for next week so that people can join their local events, national events, and even international events that are put on by the World Maternal Mental Health Awareness. And just briefly, I'm just really excited. This is really an area that our CPMP programs as health promotion programs support as best as they can because they work with this population. They serve thousands of women, birthing persons, dads, caregivers, and families every year. And when mental health concerns do arise, it is a challenge to find adequate services, supports, and treatment. So we were very excited to see that the ministers of mental health and addictions mandate letter did include as a priority to the timely access to perinatal mental health services. And we have actually with us today, we're thrilled that we have Patricia and Jaime because they are really champions in moving this work forward and have in not a very long time made significant gains in moving us closer to what Canada desperately needs, a perinatal mental health strategy. So I am so excited to introduce today's speakers. Jaime Charlebois and Patricia Tomasi are the co-founders and co-executive directors of the Canadian Perinatal Mental Health Collaborative. And we are thrilled to have you today, Patricia and Jaime. So please help me welcome our speakers this morning. Thank you.
What happened?
All right, good morning, everybody. My name is Jaime Charlebois, as we was just introduced. Thank you so much, ladies, for the kind introduction. Today, we're going to be talking to you about the slides keep changing, our action towards a national perinatal mental health strategy. So thank you so much for joining us today.
Hi, yeah, thank you for joining us. I'm Patricia, and we're excited to tell you about all of the things that we have been doing since we formed back in 2019.
So today, what we want to lead you through is a little bit of an outline about why Canada needs a national perinatal mental health strategy. And I feel you guys probably are quite aware of why this is needed. We also want to demonstrate what other countries are doing and what our other jurisdictions are doing that Canada simply is not. And also describe what it takes to become an advocate and create national awareness.
The first thing we want to do, though, is ask you to put into the chat what you think should go into a national perinatal mental health strategy. We released a report in May of 2021 that listed our 15 recommendations of what we would like to see go into a strategy. We're going to go into maybe our top 5, I think is the next slide, but we would love for you to tell us what you would like to see. Moms, dads, partners, birthing persons have access to across the country.
So in a report that we published actually on World Maternal Mental Health Day last year, which always falls on the first Wednesday in May, we published our national report with findings from a national survey that we did of healthcare providers across Canada. And we wanted the government to know from the front line what is going on in regards to the assessment, screening, diagnosis, and treatment of perinatal mental health issues. And so from all of that survey data, from all the voices of lived experience we have heard over the last couple of years, these are our top 5 recommendations that we think will help improve perinatal mental health services across Canada. So the first one is legislation that provides clear guidelines for clinicians through a national perinatal mental health strategy that prioritizes equitable healthcare across all Canadian jurisdictions.
Our second one is targeted perinatal mental health care funding allocated to each province and territory to administer perinatal mental health programs.
Our third is mandated universal perinatal mental health screening at regular intervals from surrounding conception to 1 year postpartum and beyond, as well as timely access to treatment.
Our fourth is the implementation of a comprehensive perinatal mental health curriculum directly into medical syllabuses in schools of medicine, nursing, and allied health, and ongoing training for frontline healthcare practitioners.
And our last is the investment in culturally sensitive, sorry, I have chats popping up and I can't see my slides. Hold on. Culturally sensitive, accessible, patient-oriented treatment solutions. And for all our recommendations, please refer to our report called Time for Action, which is on our website, www.cpmhc.ca.
Okay, so what is perinatal mental health? It's important to make the distinction between perinatal mental health and perinatal mental illness. In our anthology, You Are Not Alone, we have a great definition of perinatal mental health provided to us by Dr. Simone Vigode of Women's College Hospital. And it is, and she says, perinatal mental health can be thought of as a state of being where a person and their family are experiencing more than the absence of depression, anxiety, or other psychiatric symptoms. Ideally, it means that a perinatal person and their family are able to experience this stage of life in a state of overall well-being, and that every person and family has a right to achieve this.
So also understanding what perinatal mental illness is. So what we look at is a spectrum of disorders that kind of manifest themselves surrounding conception. So those years following up to conception, sometimes these are couples that are trying to achieve fertility or conception, all the way to about 1 year postpartum. So we look at lots of different diagnoses. Many of you have probably heard about postpartum depression, but 50% of postpartum depression actually occurs in pregnancy. It starts there and it's not picked up. But what we see at much higher rates is anxiety throughout pregnancy and postpartum. We also see obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, so especially birth trauma, bipolar disorder, and on the very rare occasion, about 1 to 2 people per 1,000 will experience a postpartum psychosis, which is an emergency situation. Most importantly is understanding that perinatal mental illness is the #1 medical complication during pregnancy and postpartum. So the biggest complication, and yet the least emphasis is placed on this part in pregnancy and postpartum. And so that is a very impactful statement.
What is the prevalence? Pre-pandemic, the prevalence was, which we already thought was a crisis, was 20% of women and 10% of men. However, during the pandemic, rates have soared to 1 in 3 for postpartum depression and 1 in 2 for postpartum anxiety. It's 20% higher for Indigenous mothers, 40% higher for Black mothers, and higher rates for LGBTQ plus. The 2S LGBTQIA plus community. We need to update our slide. But yeah, that's the prevalence of perinatal mental illness in Canada.
And so a big question is we see that all these people are struggling, but is it treatable? And the answer is yes, 100%. We need people to be screening and assessing and asking each person that they are seeing if they are experiencing any problems with their mental health. Do they have a mental health history? And understanding that there are evidence-based treatments such as cognitive behavioral therapy or interpersonal therapy, which are highly effective. Supportive counseling, lots of social support, so kind of creating that wraparound care, that village of support, a lot of emotional support from partners. There are medications that are safe in pregnancy and while breastfeeding, self-help, peer support, and many more that are being researched as we speak.
And where to go for help. So of course, we encourage anybody watching the presentation today or who have clients, patients, to have them talk to someone that they trust and make an appointment to see their family doctor or primary healthcare provider that hopefully will listen and have had some training in perinatal mental health. There are also some hubs in urban areas like Mount Sinai Hospital and Women's College Hospital in Toronto. And then there's the Pacific Postpartum Support Society in BC. Postpartum International has the directory of perinatal mental health trained workers across Canada. So these are some places to get help.
So another question we hear a lot is, can we prevent a perinatal mental illness? So we know a lot about the different risk factors that place people more at risk. And if we intervene early, there is a chance to at least decrease, right? So can it be prevented? It can. We need to intervene early. And what we want to do is intervene so that we're not seeing such severity in the symptoms when they do come on. So if it can be prevented, what's the problem?
Well, part of the problem is that only 15% of people are receiving evidence-based treatment. These are stats from our report, our study that we did in conjunction with the University of Calgary last year. We surveyed healthcare providers across Canada, and they told us 95.8% believe that perinatal mental health services in Canada are insufficient. 87% report they do not have mandated screening for perinatal mental illness at their workplaces. 57% report they don't have specialized training in perinatal mental illness. 87% report that persons from diverse backgrounds encounter language, cultural, and cost barriers to services. And 69% reported that COVID-19 complicated access to care.
And this is why we formed the Canadian Perinatal Mental Health Collaborative. We are advocating for change because Patricia and I both struggled through different types of perinatal mental illness. Me, almost 17 years ago, Patricia twice. And the onus was on us to find care, to find treatment at a point in our lives where we're struggling immensely. And so, you know, in the fall of 2019, we were still considered the two Barrie mums on a mission to address maternal mental health. And through the work we've been doing over the last couple of years, we have kind of progressed, and CPMHC has made some huge changes, which we'll continue to talk about.
A quick little story about how Jaime and I met. I was writing for HuffPost Canada about maternal mental health, so getting to know all the players across the country. And that's when I learned of the Perinatal Mood and Disorder Coordinator, the only one in Ontario, which was Jaime, and actually in the area that I live in, North Simcoe, Muskoka. So I arranged an interviewed Jaime for one of the articles, and that's when we found out we only lived a kilometer or two apart from each other. So we became fast friends and started bumping into each other at the grocery store, bumping carts in aisle 5, and having coffee together, and just really wanting to help whoever was leading the change. And we couldn't find anyone. We knew that there were people passionate like us who wanted to make a change. And so we decided to form the Canadian Perinatal Mental Health Collaborative, almost naively one night, writing down our wish list at Williams Cafe of what we would like to see happen. And we just went for it. And it really was an idea as time had come. As soon as we launched on social media, everyone just kind of came together like a magnet. We knew we couldn't do this alone, so we carried on and invited people to join a national committee and social media ambassador committee. So we had clinicians, researchers, people with lived experience, all collaborating into what we thought we should be doing. And one of our first social media campaigns, really successful, was our Now More Than Ever campaign, just 2 months after the pandemic started, where we asked people to send in videos of why they thought we needed a national perinatal mental health strategy now more than ever. And so there's a 13-minute video with people with lived experience, politicians across the country, celebrities, Canadian celebrities. It's on YouTube, but we just did a 2-minute snippet for you that we'd like to play now.
Now more than ever.
Now more than ever.
Now more than ever.
Now more than ever. We need to create and we need to implement a perinatal mental health strategy so that no other mother, no other family has to experience what I did.
Mental health is the most common obstetrical complication, with 1 in 5 mothers and 1 in 10 fathers experiencing anxiety and depression in the pregnancy and postpartum time.
Hi, I'm Dr. Jody Paluski. I'm a neuroscientist, therapist, and a mom. Now more than ever, we need support for those moms during pregnancy and the postpartum period to support their mental health as they transition during this difficult time.
I think what I'm struggling with, my cry. But it's really weird to not to even think that, okay, my mom can't come with me, but it's just sad, like she can't even visit me when I'm here like this, and after for sure not.
Hi, this is Morag from North Vancouver, BC, and my message to new parents is that whatever emotions you may be feeling right now are real and valid and honored.
I struggled with depression for a good 9 to 10 months after my son was born. I felt ashamed and didn't know how to cope or process my very scary thoughts and feelings. I am on the road to recovery, but I still struggle with depression some days.
Hi, my name is Christine, and I'm from Strathmore, Alberta.
Hello, everyone. My name is Nicole Weston. I'm from Barrie, Ontario.
Hi, my name is Kayla Bell. I'm reaching out from Saskatoon, Saskatchewan.
Hi, I'm Nikita from Victoria, BC.
Hello, my name is Tammy Hales, and I am the founder of Black Moms Connection here in Toronto. Specifically, Black maternal mental health matters to me because access to services and supports is less than for us as well. And we need everyone in the community to be whole and healthy.
So that was a 2-minute clip of a 13-minute video. So if you want to see more, please go to our website. So as Patricia was alluding to, we are a group of people with lived experience. We have clinicians and researchers and top researchers from across Canada that have really come together to create discourse about Canadian gaps. And go ahead, sorry, you're next.
Yeah, and we're advocates determined to change the system. The picture you see on the left is one of our social media ambassadors, Bonnie Kaw. We had a big Instagram social media campaign where we called on, this is in Ontario, and MPP Butila Carpoche, when she introduced Bill 176 in the Ontario legislature for a maternal mental health plan. This was last year. It's like everything's blurring into one now. I don't know if it was last year, the year before. There is one right now before the House. It's gonna die soon when the election is officially called. But anyways, this was the first one that Butila brought forward, and we had a big campaign. And so our followers really drive the momentum. When we put out a call to action, they really come through and do stories and posts. And fortunately, the bill didn't pass. But this, it really helps get our followers involved in policy change. And so we encourage them to be fierce advocates like we are, because we know moral suasion works. And the more that officials see that this is an issue that is to be taken seriously and that a lot of people are getting behind, then they want to make change. Yeah, is there anything else we need to say about this slide? No, we're good.
So CPMHC does a lot of different advocacy, awareness, education, research. And so what we're really asking for is universal screening. And from our survey, one of our respondents said, it is past time for a universal perinatal mental health strategy in this country. There are too many people slipping through the cracks, not receiving the treatment that they need, which is worsening their condition. Screening must be mandatory across Canada and treatment readily available and accessible. And we couldn't agree more.
Yeah, and so we're also calling for, as we mentioned, timely access to treatment. Those pictures that you see are from walks that we did in our area that Jaime expertly organized. And the one on the right there is a women's rally that Jaime and I went to. So really in the beginning, I mean, still we get out to, as many things as we can and get everyone involved. But in the beginning, in starting up the CPMHC, we knew we needed to get word out about who we are and what we want. So we organized walks, we attended rallies, we did everything we could to get ourselves out there. So in the timely access to treatment, these stats again are from our report. So we learned that when people are screened and have symptoms indicative of needing intervention, 27% of healthcare practitioners indicated that patients were able to access the referral within a month. 31% waited between 1 to 2 months, and 42% had to wait greater than 2 months for access. And so we just feel that is unacceptable.
And with the National Perinatal Mental Health Strategy, just drawing attention to the fact that our programs and our policies have not kept pace with best practices, the research, or the overarching science. And services that are currently available to those that are struggling with perinatal mental illness are largely inadequate, and issues have only been magnified by COVID-19. And so we know that people are struggling, they're isolated, they haven't been having access to the programming. You guys know that, you've all gone virtual, and although we're filling a gap, it's not the same, and our clients are struggling.
And so how do we intend to make change? We have 4 main pillars we concentrate our work under: advocacy, education and awareness, research, and capacity building. Again, we're going to drive it home. Why a national strategy? Go ahead.
Yeah. So some people kind of ask us, why national? Why not provincial? And I mean, we work hard provincially across Canada, but what we really want is that we want it to happen from the top down. We want the government to have conversations with each province and territory. And so one of our MP champions, Pam Damoff, and she is in Oakville here, talked about the fact that sometimes when the federal government shows leadership, it trickles down and other levels of government start raising that awareness. And actually, we are seeing that. And so when we envision the development of our national strategy, we want this to be the voices of everyone across Canada. So we want representatives from each province and territory, Indigenous governing bodies, other stakeholders. We want perinatal mental health care providers, specialists, researchers, advocates, organizations like yours, and individuals with lived experience. And we just want to draw attention to the fact that this is not a new concept. Patricia, back when she was reporting from Huffington Post, talked about having this type of strategy. So back in 2017, when she interviewed, I believe in this article, she interviewed Dr. Simone Vigod from Women's College Hospital, and she can speak more to that.
Thanks, Jamie. Yeah, I interviewed Dr. Simone. She was one of the experts I got to know right at the beginning of my reporting. And that's when Simone told me about the NICE guidelines in the UK. And so I did a lot of research about what was happening in the UK and couldn't believe that we didn't have that in Canada, but we'll talk about other jurisdictions in the upcoming slides. So here's a fun slide. We wouldn't be the first calling for a national strategy. Just a search of national strategies in the Government of Canada website pulls up a lot of different things. Sure, these are all equally important, but some of them, kind of raise your eyebrows a little bit. National strategy, I'm just trying to find one here. I mean, they're all, don't get me wrong, they're all very, very important. But there was one that made me chuckle a little. I can't remember which one.
Something about aliens.
Oh, well, invasive alien species strategy. I mean, it's important, right? We don't want a species taken over. It's a big problem. But what we're just trying to say here is that and not the term national strategy. I mean, you can use framework, action plan. It's just a way of saying that we really need to take this seriously at a federal level.
Mm-hmm. Yeah, see, you guys are picking up on that in the chat. So when we take a closer look at this, we see that there have been other national strategies that are gaining momentum. So one of them is the National Autism Strategy, which Health Minister Patty Haydu announced an investment of $14.6 million for the Canadian Academy of Health Sciences.
1.4.
Oh my gosh, there's a blur of decimal points.
I mean, I'm sure they would love 14.6 million.
Yes, yes. Thank you, Patricia. And then in 2021, the federal budget pledged $15.4 million over 2 years to the Public Health Agency of Canada to support the creation of this strategy.
We highlighted these four because they have to do with healthcare. And so that conversation that goes back and forth about why not do it provincially, territorially, why do it federally? Well, both have a role to play. And so federally, you have the National Dementia Strategy, National Diabetes Strategy. There was a National Mental Health Strategy actually created back with the Mental Health Commission. So we are definitely happy that we took the top-down approach, especially in light of the fact that when the new government was reelected, they announced the Ministry of Mental Health and Addictions and work on a Mental Health Transfer Act. So that's all exciting.
And so as we alluded to earlier, there are other countries that are doing substantial work on perinatal mental health. So in the UK, definitely jumped on board a little bit later, but have made a lot of progress. And so they have a Bringing Postpartum Depression Out of the Shadows Act that started with funding in 2015 to 2016, where the US Preventative Task Force and the American College of Obstetricians and Gynecologists have made recommendations for routine screening for perinatal depression. So even just this small step has made a huge, huge impact.
Mm-hmm. And we need to update this too, because there's just so much more going on. President Biden just passed a bill and legislation giving more money and supports for maternal mental health. So it's ongoing. Once the national, federal governments take it seriously, then the ball starts to roll and keeps going. So in the UK, it started it's been going on for decades, really. They've had an interest in maternal mental health for a long time, and things called mother and baby units, which we don't have even one in Canada, where a mom who needs, or birthing person or dad partner needs hospitalization due to moderate to severe perinatal mental illness does not have to go in the general psychiatric ward like they have to do here in Canada, and they can keep their baby with them and have a specialized team surrounding them while they are in the hospital. But I guess the first major announcement of funding in the UK came in 2016. With 290 million pounds into specialist perinatal mental health services, which we think is amazing and that Canada really needs. I wish we had a Jaime and a team supporting Jaime in every pocket in every city and town in this country. And then there's Australia, where they've had their national action plan that was funded from 2009 to 2015 by the federal, state governments. So Australia and the UK are probably the closest to us politically wise, but because in the US, the way they worked it was the states had to apply for grants from the federal government in order to get the earmarked funding for different programs. But basically, we're all saying the same thing. We need to take this seriously. The mental health affects our future generations. It starts before birth, and these three countries get it. So it's time for Canada to get on board. And we're seeing progress. So we're happy about that.
So we kind of just said, you know, if they can do it, why can't we? So that's what we're trying to do.
And we can. we won't bore you with every single stage of our timeline, but basically to say that from leaping out of bed during the last federal election in October of 2019, when an email came through with a personal letter from NDP leader Jagmeet Singh saying he supported a national strategy, and the CPMHC basically just got off the ground. We were so excited to, May 2020, when another one of our champions, Heather McPherson, presented our e-petition to the House of Commons calling for a national strategy, to Ontario Butilla. We participated in a press conference with her all about that bill that we mentioned before, Bill 176, to May 2021, when Heather McPherson introduced a motion in the House of Commons asking to recognize World Maternal Mental Health Day and the creation of a national strategy, and all parties unanimously agreed in theory. However, motions are not binding. So every time we made like a step forward, it's we needed to keep pushing forward, because one great success led to another, but we can never rest on our laurels. Even now that it's on the mandate letter for the Minister of Mental Health and Addictions, we have to keep going, keep pushing, making sure that action is taken now, not 1, 2, 3, 4 years, 5 years from now. So here's a video of Heather McPherson introducing the motion. We'll just play that for you.
Motions. The Honourable Member for Edmonton Strathcona.
Thank you, Mr. Speaker. There have been discussions amongst the parties, and I believe that if you seek it, you'll find unanimous consent for the following motion. That the House recognize 20% of women and 10% of men in Canada suffer from perinatal mental illness, and rates of postpartum depression have doubled since the start of the COVID-19 pandemic. Black, Indigenous, people of color, people with disabilities, gender and sexual minority populations experience higher rates of perinatal mental illness. A new study by the Canadian Perinatal Mental Health Collaborative shows that 95% of healthcare practitioners believe perinatal mental health services in Canada are insufficient, and advocates are calling for a national perinatal mental health strategy. And that in the opinion of the House, the government should develop a national perinatal mental health strategy and follow other countries in recognizing the first Wednesday of May annually as World Maternal Mental Health Day.
All those opposed to the Honourable Member moving the motion will please say nay. Agreed? La Chambre a entendu, non?
The House has heard the terms of the motion. All those opposed to the motion will please say nay.
Adopted or carried.
So after each one of these successes, Jamie and I are like, oh, we should open a bottle of champagne. We should. And the latest one was Jamie was like, we should go to the keg. Oh my God, not the keg. But we never have time to spend too much time celebrating. It's just moving on, moving forward.
Push. We won't rest. So in July of 2021, we were very happy to find out that the Mental Health Commission of Canada also recommended a national perinatal mental health strategy, and our survey and national report were cited within their report. And their two recommendations talk about conducting a gender analysis with gaps in perinatal mental health, health and social services, ensuring long-term follow-up, virtual service, in-person service, and coverage that works and is culturally appropriate, and utilizing gaps in perinatal mental health coverage as a basic action, and for system equality improvement with the National Perinatal Mental Health Strategy. So we were so excited that, with the huge link between maternal mental illness and infant, child, and adolescent mental health challenges, that these connections are being drawn and being presented to multiple levels of government.
Okay, we're gonna speed this up a little bit. Just going along the timeline, we mentioned already the federal election. We got on the mandate letter after the government was elected. And then in November is when Butila reintroduced the perinatal mental health bill. So it's passed first reading so far, but I guess it will die again soon, unfortunately. But she is committed. The NDP Party of Ontario has put National Perinatal Mental Health Strategy into their platform, which they just released a couple days ago. We're waiting to hear, we've been lobbying each party. So we're waiting for the Liberals platforms, the Conservative platform. Hopefully they will all have perinatal mental health in their platforms in some way, shape, or form. Here's just a quick video of some of our followers on Instagram really rallying around this bill.
The vote on the motion for second reading of Bill 176, an act to proclaim Maternal Mental Health Day and require a review of maternal mental health in Ontario and the preparation of a provincial framework and action plan, has taken place.
The ayes are 12, the nays are 28.
The ayes being 12, the nays being 28, I declare the motion lost.
Oh my God. This gives me all the feels this morning. I haven't watched that in so long.
I was just going to say that. I'm kind of teary.
The dramatic music and everything. And oh my goodness. Sorry, everybody.
We impress ourselves sometimes.
No,
it's okay.
it's so, you know, everyone
Wow.
came out and they were so disappointed when it didn't pass. I mean, we kind of knew it wasn't going to just because of politics, but oh my God, everyone was so disappointed. Okay.
Moving on.
Yeah.
All right. So we were really excited in the fall of 2021 when the Hill Times did an awesome article on us about our grassroots movements, about the National Perinatal Mental Health Strategy and pushing that forward. And one of our champions, again, Heather McPherson from Alberta Strathcona, talked about, you know, I think for us, the next step is to bring some parliamentarians together from all parties to really push this and really say, it's time. Time's up to get this work done. Sorry, I botched that. But, you know, it's so great to have these champions, these political champions that get it, that push it forward every chance they can. And, you know, they're reaching out to us. And so we're so happy to have these people in our work.
They're reaching out to us, but we reached out to them first. So it's about really, you know, pounding the pavement and having meetings with MPs and MPPs. So glad, you know, you said that, Jamie, but everybody worked really hard to get their ear. But once we had their ear, they were on board 1,000%. And now, like we keep saying, we're so excited. We cried tears of joy. We're on the mandate letter, but that doesn't mean that it's over and that we get the national strategy or we get part of the Mental Health Transfer Act. It's just, you got to keep going. Just because it's on the mandate letter doesn't mean it's going to happen. So as soon as the election was over, we went on a media blitz and we issued a press release saying, great, we're on the mandate letter, great, but let's start doing it now, not 4 years from now. And we had media from across the country. We went live on CP2 for just pushing this, you know, pushing, saying this is great, but let's get some action. And then just this past March, MP Don Davies reintroduced his private members bill calling for a national strategy. And Minister Bennett, the Minister of Mental Health and Addictions, went over to have a chat with him, which we told was a great chat together after he introduced the bill. And then we had a meeting with, this was another great day. We had a meeting with the minister, Jamie and I, and MP Pam Demoff, and to talk about what to do next. And so we're so thrilled that the minister is 100% on board with moving forward with perinatal mental health. And then we had a stakeholder roundtable. I'll let you talk about this, Jamie.
Oh,
just trying to go fast because I know we're taking up some time.
Yeah. So Dr. Simone Vigod of Women's College Hospital, Minister Bennett used to work at Women's College Hospital. She's a family physician. So, you know, she's been working at this. She's delivered thousands of babies over her career, and she gets it and she understands. And they convened a round table with experts from across Canada to talk about what is current state, what's going on, what do we need to do to move this forward, to create accessibility, to create a national strategy. And it was so empowering. And from that roundtable, they will be publishing a report. Patricia knows the name of it. And I keep forgetting.
What we heard.
Yeah, what we heard. See, you'd think I'd keep that in my mind, but I don't. So that should be coming out soon, and that will be available.
Okay, how to advocate. I think we kind of already went through this. We keep asking people for meetings, and we keep talking about it. We're not afraid to approach people. We had all of those logos that you see down there. We had all of those wonderful foundations and organizations supporting our call for a national perinatal mental health strategy during the election. We have a new board of directors that we just brought on now that we're a legit nonprofit. We're not two Berry moms on a mission anymore. So we went through a hiring process. We have an excellent new board of directors bringing us into the future. And we've launched Flora's Walk for Perinatal Mental Health. It's been happening since February. A lot of groups are walking across the country on May the 4th. This was for in memory and in honor of Flora Babakani, who tragically died by suicide after her postpartum psychosis, her prenatal postpartum anxiety, and then postpartum psychosis were not ever flagged. She was never asked about her mental health. And sadly, she was supposed to get help on a Monday and died by suicide on a Friday. Very sad. Her family wanted to get her story out. And so we are organizing this walk. We do have a video. It's a couple minutes long. I don't know. Do we have time? Yeah, we have time. We'll play the video for you. Oh, no, we won't play the video for you. Sorry. Basically, the video was Flora's sister Mimi, who is helping us get her story out, talking about, you know, that she believes that if she was asked about her mental health, perhaps she would still be with us here today. And I know hindsight is 2020, and we can never say for sure if Flora would be with us today, but we are probably sure that she would have had a higher chance of being with her baby Amber today if she was flagged. So we've had sponsors for the walk across Canada. People have been walking on their own. People have been organizing walks for May the 4th. We're going, and here's where the money is going. For every person that fundraises, they can choose a charity in their local community that helps perinatal mental health services, and 50% of what they raise will go to that local organization. 20% goes to families in need. This year, that will be Flora's sister Mimi, who is adopting Flora's baby Amber. 20% is for training scholarships to provide that specialized perinatal mental health training for healthcare practitioners, and 10% to cover our admin costs for the fundraiser, and any leftover from that we will be putting to good use for awareness. So that brings us to the end of our presentation, and please, if you can go to our website and check out Flora's Walk and donate if you can. On May 4th, we will be in Ottawa, and the Minister of Mental Health and Addictions will be speaking at our event, as well as MPs Pam DeMoff, Don Davies, Heather McPherson. We have Kate Baker from the Royal in Ottawa who's speaking, and we have Dr. Vera Etches, the Medical Officer of Health from Ottawa Public Health, who's speaking. And then we're walking around Lansdowne Park. And when we come back, we have a panel with a lot of the service providers in Ottawa who will be answering people's questions about perinatal mental health. It's a huge event we've been planning for, and there are lots of events happening across the country as well. So I think that brings us to the end of our presentation. Thank you for listening us talk about ourselves. We want to hear about you and the wonderful programs that you're running, and we're happy to take any questions that you have.
Thank you so much. So very inspiring, as I'm seeing in the chat. And what I'll do is I'll change the permissions so that if you do have a question or a comment and you want to just unmute yourself and or feel free to jump on video with us. It would be wonderful to see your faces. And Patricia and Jaime would be happy to take your questions. I didn't see any in the chat. Did you, Blanca? I just comments. I didn't see any questions. So if anybody has a question now.
I did have a quick question. When you met with Minister Bennett, was there any?
You want us to spill the tea?
Yes. What did she say?
Oh gosh. Well, at the beginning we were told this was all confidential, and then they posted it on Twitter. So then we were like, well, let's get a green light. We're going to post it on our social medias that it happened. We just talked about what we thought were, what we all thought were what was working well and what we think needs improvement. So from our presentation, you can basically imagine what we said.
Yeah, we don't have the green light to tell you everything in detail that happened in that, but the report, I think, will be a very fulsome, depiction of what we spoke about and what the next steps will be.
Okay, I see.
Hi, Janet.
Hi, Jaime. How are you?
Nice
so I do have a question, and this picture of me is like way better than what I actually look like. So I'm just going to leave it up. First, let me say, kudos to you and Patricia. You guys are just heroes for so many of us who have been in the trenches for longer than we care to admit around perinatal mental health. So thank you for your advocacy. And I have a question, but I wanted to mention as well, I mean, those of us who are in public health, we've really been stopped in our tracks by the pandemic. We've been redeployed to COVID work. And so, I in the past have helped run peer support groups. It's all stopped, and so your advocacy is needed more than ever, because some of us close to the women haven't been able to actually support them. My question is just a simple one. It is about your resource where you talked about the statistics during the pandemic, because I haven't heard that clearly before, how those, the percentage of women has gone up. So what's your source for that? Was that a survey? What was it?
So there's been a ton of research by many of the people on our national committee, especially Dr. Leanne Tomfor-Madsen of University of Calgary. And one of her leads is Dr. LaBelle. So there's tons of research. So part of one of her studies, they did a survey, I want to say at the beginning of the pandemic in 2020, where they surveyed, I think, like 4,000 women who were pregnant. And so a lot of the evidence is coming out of that. And then there have been tons and tons of research studies internationally about the numbers with perinatal mental health issues. And, just the statistics for me when they talk about, how much anxiety is occurring in the communities right now. Like, we know it, we see it, we're feeling it as practitioners, as frontline, as people intervening with these families, but to see the number in the 50s and 60s and 70s%, it's heartbreaking.
Great. Okay. And I see that Patricia's put a link in there. So that's good. I just, I think you can appreciate, I want to go back to my organization and say, this is what's happening now, but they want the hard numbers. So if I know the sources for that,
I'll send you,
helpful.
Dr. Vigod did a presentation for Ontario Public Health Association. So you can get that recording. It was really great. And on one of her slides, she lists a bunch of the studies. I can certainly send you some, but that would be really great to bring back to your team, because it was an OPHA presentation.
Yes. Great. Thank you so much.
You're welcome.
Well, wonderful. Well, we would like to give away some copies of the You Are Not Alone anthology. And I'm wondering, do either of you have, here, I'll do a little screen share on your press release about it. Is there anything the two of you would like to say about this book?
This was one of our dreams that we wanted to do. Is we know that probably the most effective way to create change is through stories. Not so much stats, but stories. And so this evolved from our hashtag This Is My Story campaign, where we were interviewing moms and then posting it on a blog on our website. But we wanted it in a hard book format and also ebook, so moms or dads or whatever at 3 o'clock in the morning who need support can just go on and read. So all these stories are true stories. 49 moms across the 49th parallel. There are some stories from the US as well, from preconception all the way to postpartum, also dealing with things that we don't hear about too often: tocophobia, the fear of childbirth, post-adoption depression, miscarriage, which are all on the spectrum of perinatal mental health conditions as well. We also have experts that have written chapters with information and to provide more education, like Dr. Simone Vigod and Dr. Ryan Van Lieshout. We have also Karen Kleiman, who graciously wrote a chapter for us. She is the star advocate in the US, runs the Postpartum Stress Center in New York, and a lot more experts: Dr. Nicole Fairbrother from UBC, Dr. Jody Paluski on the history of perinatal mental health. So it came out last year, and we're giving copies to also the MPs when we go there next week in Ottawa. So basically that's it. Yeah.
Awesome. Awesome. So we'd like to give away 3 copies. So we've got 3 questions, and when we were chatting with Patricia and Jaime, getting ready for this event, we thought one question might be around, I believe, Jaime, you told the story of how you and Patricia met. And was the question, where did you meet or how did you meet?
Doesn't matter.
Yeah, Patricia actually told the story today. So yes, Belinda, you're right. So we did meet in Barrie, yes.
All right. So Belinda, you are getting 1 copy of the anthology. And so if you could, well, if all of our winners could send me an email, and I'll put my email in the chat. But let's go on to the second question. And early on in your presentation, you talked about evidence-based treatment and how important that is. And you gave us a stat on how many people what percentage receive evidence-based treatment. And so what is that percentage? What percentage of folks are receiving evidence-based treatment for perinatal mental health issues? Did anybody remember? It was kind of early on in the presentation. Judy, you're close. Not quite right.
Oh,
Ellen, you're so close. Oh no, there you go.
Janelle was close.
Yeah.
Ellen got it. Ellen. 15%.
I think Karen Chan was the first one.
Oh, was she?
Oh, really?
Oh, good eyes. Sorry, Ellen. You're right. Karen Chan, 15%.
Sorry, Karen. It went so fast.
It does. That is awesome. Okay. And
you guys are good.
You are good. And then finally, we were hearing about all their advocacy and a bill that we were looking to get passed. What was the bill number for maternal mental health? Okay.
Oh, gosh.
So
that was
I have
really
to make sure to
fast.
get these names down. So that was Jillian Hurley. That's right. Jillian
was the first one.
Hurley. And then it was Karen Chan who.
Yes.
And then who got the first one? That was Judy Kurtz. Is that right? Sorry,
Belinda.
Belinda. Okay, so that is awesome. I'm going to put my email in the chat right now. Pardon me.
For those that want to get the anthology, it's available on Amazon and Indigo. Amazon, you'll get it within a day. Indigo, it takes several weeks, just letting you know.
Gotcha. So thank you. I will follow up, ask our winners to follow up with me. My email address is there in the chat, sydneybell@horizon.ca. I mean, sbell@horizon.ca. So if Jillian, Karen, and Belinda could send me an email and we will get that anthology sent out to you. And I think with that, we're coming to the end of our time together. I will be sending a follow-up email with a link to an event survey. And I think I saw something in the chat about wanting studies sent out. What was that?
Yeah, the link to that study that Patricia shared, if we could share that as well. And Jaime and Patricia, if you had any other studies or resources that we can use in our roles, that would be helpful for us. Please, if you could send that to Sydney and I, and we will pass it forward.
Great. Thank you so much, everyone, for your time and attention.
Thank you so much. And Patricia, if you could email me that link, I'm just not able to grab it off the chat. That would be awesome. Thank you both so much for your time. It was just so both informative and inspiring, and just really much appreciate your time and for everybody for joining us today. I hope you have a great rest of the day and that we see you again soon.
And Patricia and Jamie, let us know how it goes with Flora's Walk and
yes,
next week's events. I know you'll be very busy, but thank you so much. We are just so appreciative of all your work, your efforts. I know it's not easy. It's definitely challenging, all that you have done, but you guys are amazing. And we were just so grateful that you were able to join us today and tell us all about the work that you've been doing. So keep it up.
We're cheering you on and walking alongside.
Such important work. Thank you.
Take care.
Bye. Take care.
Thank you. Bye.
Thank you.
Thank you. Bye.